We will be discussing with the topic monitoring and assessing patients on ventilator. So this will be a helpful session for those who are working as bedside ICU nurses. So first we will see the assessment and monitoring will be divided into specially two types or two areas, that is the primary assessment and the secondary assessment. So we will see what is coming in the primary assessment and what comes in the secondary assessment. So before that, can we think of why the monitoring is very important for a critically ill patient, or what type of monitoring will be we will be carrying out? So in the ICU, most of the ICUs we will be 1:1 patient nurse patient ratio, because monitoring or observing the patient is critically important as a part of the treatment. So how we monitor the patients, or why we have to monitor the patients? Monitoring of a patient on ventilator interactions at the bedside is an integral part of the nursing care, and it involves examining the impact of the patient's breathing and behavior on the ventilator setting, and vice versa. Also, the goal of monitoring the patient is to detecting the problem and manage them as easily as possible. As we say, is that prevention is better than cure. So we have to prevent patient going into further critical complications through early detection of the problem. That is always through the monitoring the patient or assessing the patient properly, especially when they are on the ventilator. Important parameters should be monitored at regular intervals in a systematic manner. So how we can do it in a systematic manner, and or how we should do it in a at regular intervals, that is what we are going to see in these slides. Okay, so first we can divide the assessments as core. It is always the assessments or monitoring, it should be core. It's very important. It's a core assessment. It should be evidence based and a collaborative. It should be based on the collaborative principles. So as I told in the previous slide, the assessments is divided into three mainly. First is the primary assessment or the primary survey. Once you enter into the patient room, or once you start your treatment, or once you start your beginning of the shift, at the beginning of the shift, what all things will you are supposed to do as a primary survey. After doing the primary survey, it's very important as a bedside critical nurse, we have to do the safety check. There are certain things we have to, every beginning of every shift, we have to make sure that the safety checks are to be done. And next is the secondary survey. So when it comes to the primary survey, what all things you will check, because it's divided in as an ABCD manner. So as we all know, airway comes first. So is the airway is patent? Is it secured at what lip level? Or is it stitched? If in case of tracheostomy, whether that is stitched or no. And you will listen to the air movement. Observe the rise and fall of the chest. Check to be secure and the length is correct. Then next comes the breathing. Is the patient's breathing? What is the saturation, target saturation? Is the patient is maintaining that saturation? What about the tidal volume? What type of mode the patient is on, and whether the patient is in compliant with the ventilator settings and the mode, respiratory rate, all those things related to the ventilator settings comes under the breathing. Then we go to the circulation. In the circulation, as we all know, that it's the heart rate, rhythm, the blood pressure, especially the most of the patients will be monitoring by arterial blood pressure, as we all know, invasive blood pressure. Then type of the pulse, the strength of the pulse, color of the patients, all that comes in the session under C. And disability, what sedation a patient is on. Most of the patients will be on sedations. And what GCS, or what is the RAS score. Is the patient is quiet, calm, cooperating, or fighting with the ventilator, or restless, or the patient is in pain, the patient having any fever. All those things comes under the disability, D. And next, so as we go to the ABCDs, we can go up to H or we can go I, but primary assessment ABCD is enough. And you will keep on continuing monitoring the patient, the remaining F, then all those alphabets until the I. That comes the fluid balance for the F. Is the patient on any fusimide infusion, or is the patient getting any diuretics? Patient pass what target fluid balance the doctors are told you to maintain, and is the patient is maintaining that target. Then comes the G. In the G, the bowel, when the last bowel open, is there is any abdominal distension, what about the bowel sounds, or any feed the patient is on. Then I forgot to mention about the E, the exposure, what all things the patient is attached, what all lines are there, that comes in the E. There is any skin problems, that also comes under the exposure. Then so E, F, G, H comes all the hematology, all the lab values. Then then last is the I, which comes the infection, what antibiotic patient is on, all those things. So but as a primary assessment, up to day is enough. So then we move to the next monitoring part, that is promoting the safety. So we have check, all the hospitals have their own policies, how they will do the safety check, how they maintain the equipments. Especially you have to check the working condition of the oxygen, which is readily available to the near the patient bedside, the oxygen point. Then the ventilator connections, power supply, all the patients monitor, ventilator, everything is switched in properly. Then the suction is working properly. Then all the emergency equipments you have to check, like in case of any accidental extubation or any desaturation, what all things we need to be kept ready at the bedside. This will come in your safety checks. So another part, very important part, is you will check the alarm limits. So whether we are not sure that the staff, those who are taking care of the patient, what limit they were setting and what parameters they were monitoring. So always make sure that your monitors, alarms are limits are properly checked and it's set within, and always the alarm should be on. So that comes the safety portions. Also we have to check the parameters that we put in the ventilator, whether it is correct according to the patient weight, the gender, so that the tidal volume will be calculated accordingly. And what in addition, you can also see that the patient is whether on the ET tube or in the tracheostomy tube, and about compensation. So all these things will come under the safety portion. Then we move to the secondary survey. So in the secondary survey, we go further detail, that will be in a systematic approach. As we all know that it comes all the system, that is the respiratory system, circulatory system, gastrointestinal, urinary system, that all will under the systematic approach. So first is, as I told you, it's the respiratory system. So further you break down the respiratory system, there are lots of things you have to complete addition to the primary assessment you did. So you can see that it's the what type of airway, tube placement, tube security, cuff status, assessments of the lung secretion, adequacy of humidification, that is if the patient's ventilator is on a wet circuit or on a dry circuit, whether it need to be changed from dry to wet, or we also check the humidifiers and the filters. Sometimes it get wet and the patient compliance will be obstructed due to the wet filters. Then ABG analysis, pulse oximetry, EtCO2, endotracheal suctioning, these all comes under the, it's not restricted to what I mentioned, only these things. You can still further go ahead with the respiratory system if you feel that you need further assessment. Then moving to the next is the assessment of the breathing is designed to detect the signs of respiratory distress or inadequate ventilation. So you will check on the ventilator parameters, what the ventilator giving, whether the patient is accepting, that means the compliance, basic settings, all the parameters and the desired modes. So that comes in the breathing along with the respiration in the respiratory system. Next is the circulatory system. As I told you, the heart rate, blood pressure, edema, peripheral skin temperature, pedal pulses, any signs of bleeding, serum electrolytes, especially the potassium. Observe for signs of DVT, administration of low molecular weight heparin or enoxaparin in order to prevent any blood clots. Observe for complication associated with poor cardiac output. Regular assessment of HB, patient temperature, capillary refill time. Next, we'll move to the neurological, that is the GCS, coma score, then ability to communicate, sedation score, pupil reaction, responding to the pain, sedation hold. It's very important as a bedside nurse every day, especially in the morning shift, you have to do the sedation hold and see that how the patient is responding to you. And next is the BIS monitoring, that is you are assessing the amount of sedation you need to reduce or increase according to the BIS score. Then next is the GI. In the GI, the impaired GI functions, reduced GI motility, amount and characteristics of gastric aspirate, assessment of the muscle mass and degree of muscle wasting, serum phosphate level will come under. So all the ICU lab comes routinely, we are checking all these things. So as a bedside nurse, you should also be aware along with the doctors that any replacement is needed for all these things. So compromised hepatic blood flow clotting screening, nutritional status is very important. So as early as possible, the patient should be fed through NG or any other whatever is possible if the patient is unable to eat, because of course the patient is on ventilator and they cannot be fed orally. So we have to find a solution for that. So that is a very important thing. It comes under GI system. So next we move to the metabolic system. So again it comes the temperature, because it's an integral part to know that the patient having any infection. So all the infection control measures, how you will monitor, how you will take care of the ventilator circuit, prevent it from limited interruptions of the circuit, hand hygiene, the VAR bundle. Then the blood glucose monitoring and controlling, it's very important thing, because the due to the stress related to the ventilator, there is a high chance that patient's blood glucose can go high. So you need to monitor it regularly and make sure that it is within range, especially the patient, those who are diabetic. And initiation of this body's response that occur in the critical illness. The surviving sepsis guidelines recommend that patients with the severe sepsis have a blood glucose level maintained less than 8.3 millimole per liter. So moving to the next is the skin integrity and mobility. In the pressure ulcer risk, because the patient is continuously lying, they are unable to move due to the sedations. So we have to make sure that we at least every 3 to 4 hours we have to change the position of the patient, and it also helps in improving the lung expansion and reduce the risk of ventilator associated pneumonia. Last not but the least, it's the renal functions, the urine output, serum electrolyte, urea and creatinine. Because of the less cardiac output, less mean arterial pressure, and the renal perfusions will be less and resulting AKI. So we have to make sure that at least 0.5 ml per kg per hour is urine output should be there for adequate urinary perfusion. Along with this, the foremost thing, and of course we are neglecting this part because the family and the psychological support is very important. In the most of the ICU, the visitors are very much restricted due to the infection control and the busy schedule in the ICU, but it is very important for the early cure and for treatment. It is an integral part that the psychological support of the patient should be met, as well as the family. So it's very important if your hospital is allowing you to prepare a diary, maintain a diary that that we can write what all happened when they were sedated, so they can understand once they come out of the sedation, because most of the patients, they won't remember what happened in their life. So it's very important that if you maintain a diary, and you can also ask the relatives to write in the diaries. Because of the COVID situation, most of the hospital we are not allowing the visitors, but it's very important. You can always communicate what happened to their relatives, what happened to their dear ones in the ICU every day, update the family, then also convey the message to the patients. Even though through the diaries we can put a note like this was the message passed to your family, and this is the message they had passed for you. So effective communication is very important. It's very, very much important in the caring a patient, those who are critically ill, and especially those who are on ventilator. I hope. Thank you again. Bye.